Hello, my name is Yvonne McKenzie, graduate student at Brandman University, and I'd like to start my integrative therapy video at this time. This case involves an African American male who complains of feeling anxious when at home, out with friends, and at work. He also fears of being a failure, which he feels attributes to his anxiety. He has struggled with these thoughts since he lost his job 2 years ago, and as a result, he lost his home as well. He has gained employment currently and now is renting a new home. However, he fears of losing his current job because of the actual fear in his mind and anxiousness of doing something wrong and quote unquote causing a disaster again. Patient John is a 52-year-old single black male who lives alone. Both mother and father are living, and he has one adult son who recently moved away to his own home. He has never been married. He is currently dating. He is a non-smoker and a non-drinker. He is currently taking medication for hypertension, hyperlipidemia, diabetes type 2. This is his first complaint of anxiety as he came to be seen by the psychiatric mental health nurse practitioner. He is currently undergoing psychotherapy sessions with the nurse practitioner. The three therapies used in this video demonstration are cognitive restructuring and reframing, therapeutic journaling, and mindfulness meditation. The blended therapies will help to develop insight in a positive thought process as well as creating a different perspective for his life in general. Cognitive restructuring and reframing is a psychological technique that consists of identifying and then changing the way situations, experiences, events, ideas, and or emotions are viewed. Cognitive reframing is a process by which such situations or thoughts are challenged and then changed. According to Dr. Alice Bowles, the former clinical psychologist turned writer, author of a book titled The Anxiety 2 book, she references that this technique helps with anxiety by modifying problematic thoughts, which in turn can help you change your anxious or depressed behavior through patient-related discussions to help John understand how emotions and thoughts are connected and what triggers him. Therapeutic journaling, which we will do as a final modality, is a process of writing down your thoughts and emotion, which enables one to express themselves and work through difficulties and move forward, as well as make sense of internal experiences, learn and gain new perspectives on life challenges. According to a randomized controlled study held by the Braun-Brennan Center for Transitional Research in 2010, of older adults with ongoing medical conditions and anxiety. They found that journaling helped to decrease their mental stress load and increase their overall well-being. Janice Whitlock, a research scientist at the Braun-Brennan Center for Transitional Research, studied adult and adolescents' mental health and well-being. She is currently launching a journaling project called Telling Our Stories in the age of COVID-19. She acknowledges that writing down your stories and experiences and feelings is an evidence-based strategy for coping with anxiety and negative emotions during any major crisis. Mindful meditation is the practice of basic human ability to be fully present, aware of where you are and what you're doing while learning through meditation, breathing techniques, not to overly react or become overwhelmed by what's going on around you. Dr. Christopher German, clinical instructor for Harvard Medical School, he also is a co-editor of Mindfulness and Psychotherapy and author of The Mindful Path to Self-Compassion. He endorses mindfulness meditation for anxiety and stress management, and to help to be tuned into your senses, noticing your thoughts and emotions of the present to capitalize on full relaxation. I believe the three modalities are appropriate in this case because cognitive restructuring will focus and teach Mr. John to assess his own negative thought patterns that lead to his ongoing feelings of anxiety. Also, to rechannel his automatic thoughts that create anxiety And once he's aware of them, he can then learn how to reframe those thoughts so they are more positive and productive. Mindfulness meditation will allow Mr. John to focus on learning new ways to relax and provide stress and anxiety relief for himself to use at home, as well as gain knowledge to be present with his thoughts and not to overreact or become overwhelmed by what is going on around him. Therapeutic journaling will write his thoughts down on paper and get in touch again with his own thoughts about himself. He will record both his positive and negative thoughts that has occurred to him between sessions and keep track of new thoughts and new behaviors that he puts into practice as a result of these sessions. My expected overall encounter with Mr. John will be that he will be engaged and encouraged to gain knowledge on how to better control his negative thoughts and be more aware of the present and the more positive aspects of his life. For example, instead of saying, I am a failure, he will then rechannel those thoughts to say, quote unquote, I've made some mistakes that I feel embarrassed about, but a lot of the times I make good choices. I am also expected to see a nice blend and flow of each modality, as each modality should help to introduce the next and show evidence of improvement for Mr. John. Now, cultural diversity is important when creating a meaningful and beneficial treatment plan for clients. It's crucial to be knowledgeable of cultural differences in expression and dialect when assessing different cultural groups. For example, for the Hispanic community, typically they will reference anxiety as nerve attacks and referring to an episode of intense emotional expression due to interpersonal stress that they may be undergoing. It is important to focus more on the physical descriptions with Latinos to help determine the mental disability as opposed to them describing the situation or experience. For example, they may speak of, I have a fast heartbeat. I'm sweating, and I do these things when I'm doing for example, when I am speaking, which may cause a great anxiety for them. If they will describe it in a different way, putting more emphasis on the physical disability when they're going through their anxiety issues. I'd like to start off with my very first therapy modality, and I will introduce and bring in, not introduce, but I will bring in my patient. Hello, Mr. John, please come in. You can have a seat right here. Mr. John? Mr. John?
Yes.
Okay, our first therapy will be cognitive restructuring and reframing. Now, that type of modality or therapy is an exercise for us today. It will help you to reframe from overgeneralizing, assuming that the worst will happen, and placing too much importance on minor details. So I'm going to start off with just asking you a few questions. Here's the first question. But before we start, I will need to consent before we start our session, Mr. John. Do you understand and give consent for these sessions to be video and audio taped and be submitted to Brandman University?
Yes, I do.
Okay, great. So we will get started, sir, with the first modality, which is cognitive restructuring and reframing. I'll ask you the first question. Do you notice any time you feel yourself making a negative prediction about your place of work, which we spoke on that before in our last session about your negative feelings about losing your previous job? And while you're on your current job and doing a good job, you still have the negative predictions. So do you notice any times you find yourself making negative predictions?
Well, I feel that every time my boss tells me something to do at work, I'm afraid I'm going to screw it up and find a way to, mess up my reputation. as a good employee.
Okay. Okay. Now, when you find yourself having the cognitive distortion, is that's actually what you're having because you haven't experienced anything negative thus far in your new job, correct?
I guess maybe.
Okay, I want you to listen carefully to the question, okay? Okay. When you find yourself having the distortions, I want you to ask yourself what other ways you could think. In other words, what other outcomes are possible? I guess you could actually, could you explain that?
Well, I mean, I could get fired, and then I have to find me another job again.
Okay. Now, is that the worst possible thing that could happen? Or tell me what is the worst possible thing that could happen?
The worst possible thing that could happen is I have to find me another job if I get fired. That's the worst possible thing.
Okay. What's the best possible thing that could happen?
Well, my boss could like some of my ideas and I can get a raise and more money.
Yes, that's very good. What is the most realistic thing that could happen?
Well, that my boss would acknowledge my good ideas and give me a give me some good feedback on whether or not they can use them or not.
Okay. Now, that is also a realistic thought. And I like for you to do a homework project for me, Mr. John. Each time you had a negative prediction about anything, I want you to write them down, okay, and follow up with 3 questions to yourself and make sure to record both negative and positive as well as a realistic outcome. I will give you the paperwork with the questions listed as well as the instructions. But those 3 questions will be the 3 questions that I just asked you and we worked together. You answered those questions. The first one was, when you find yourself having the distortions, what other ways you could think about them? What's the worst possible thing that could happen to you? What's the best possible thing that could happen? And what is the most realistic thing that could happen? Anytime you have the negative prediction, whether it's on the job, at home, or sociably amongst your friends, okay?
Okay.
And that is your homework.
Okay, I think I can do that.
Okay, thank you, Mr. John. Okay, Mr. John, we're going to our next week. I'm glad to see you here with me again. This week, Mr. John, we're going to do a mindfulness meditation. The mindfulness meditation, let me describe it to you, sir. It involves picking a focus of attention, such as breathing, and we're going to do breathing exercises for about 3 minutes. And we're going to focus on experiencing the sensations of the breathing. During the breathing process, you're going to focus on the feelings that you are receiving currently while you're breathing. Trying to place less focus on what's going on in your mind. It may be difficult at times as you're breathing because your mind will drift off and you will begin to think about things that may happen tomorrow or things that have happened yesterday. You just be calm and you go back to focusing on the breathing and the relaxation and what the breathing is offering you. And that is a sense of relaxation. So we're going to begin. I want you to sit straight up in your chair. And I want you to place your hands in your lap. And I want you to begin to inhale and exhale. And you're going to inhale again with your mouth closed and exhale. During this process, I want you to feel your breath. Follow it as it goes in and out. Also, be there for a few moments. Relax. Bring your attention to your breath or your sensations in your body and see where this makes you, or not make, but where your mind goes. You rechannel it back to what's happening to your body as you relax. And for your homework, I would like for you to do this several times during the day, preferably once in the morning and once in the afternoon. Okay, Mr. John?
Okay.
Thank you very much.
You're welcome. Thank you.
Now, as we move on to our final modality, and that is journaling, therapeutic journaling. Therapeutic journaling is a way and a process of writing down your thoughts, emotions, and experiences. Some positive and possibly some negative as well. Mr. John, I'd like for you to take the time to write about any events that have brought up difficult emotions for you. Okay? And I want you to think about them as you write them down. I'm giving you the pen right now and the paper to write those down now. And you can begin to write those down. You're going to write about the events that brought difficult emotions for you. Okay?
Okay.
Now, you can share these with me today, or you can keep them private. Okay? You have that option because these thoughts are your personal thoughts. But if you wish to discuss some, we can.
Well, I can tell you that one of the things that, well, it's a big thing. Losing my job. When I lost my job, yeah, it kind of broke me. I lost my confidence, and I wasn't sure if I could get another job.
Okay. Okay, now that's very good. Very good. I want you to continue to write those down. And you have homework again. Mr. John, you will continue to jot and write down your thoughts and allow yourself to be in a private room where your thoughts can flow and you're relaxed at the same time. And then you can, sir, you can keep those private, or you can, when you come into your next session, you can share them with me as well. Okay?
Okay.
All right. Thank you, Mr. John, and I appreciate you, and I'll see you next week.
Thank you.
You're welcome. Okay. My patient has left, and a summary is the overall session was successful in that Mr. John showed interest and participated in the 3 modalities. He expressed himself as he responded to open-ended questions, and he allowed his thoughts to flow easily. Although his negative thoughts continued to linger, he also began to incorporate some positive thoughts as well, and his emotions flowed with the questions that was asked by myself. Cognitive structuring helped him to understand the debilitating effects of automatic thoughts and how to reframe them by saying something positive about himself. Mindfulness meditation allowed him to focus on relaxation and bring his mind to the present, to what he is doing currently, which is breathing exercises when he's actually doing the meditation. He was able to receive immediate satisfaction, and therefore he understood the impact of this exercise as he plans to do this at home as well. Therapeutic journaling, Mr. John is able to see his negative thoughts as he compares them on paper, his positive thoughts, and he is instructed to begin to keep track of his new thoughts throughout the sessions. He was also given homework to continue to journal, and he's given the option to share those thoughts with me or keep them private to himself. And he's also been giving an additional homework assignment, which is to continue to meditate with relaxation techniques of breathing. Thank you.